All right. Good evening, everyone. Hope everyone's doing well. Thank you all for parents for taking the time out to join us for tonight's safety session related to COVID. I'm really hopeful that I'm going to answer all the questions you guys have as you're thinking about how we're keeping our kids safe in buildings this upcoming school year. First thing I'd like to do is just say thank you. My name is Donnie Tinktum. Uh, I was principal for two of our KIPP schools for a long time. This past year, I spent the last year sort of helping our schools think through protocols and safety procedures and how to implement them at a school level. Again, I want to say thank you to all for really giving us the trust to have your kids in buildings to make sure that we can create the safest place we can for our kids. And again, that means a lot to me. I said that all the time to parents when I was a school leader, and say it now again. Thank you guys for trusting us with your kiddos. All right, today there's you can really ask questions in two ways today. The first is you can use a Q&A feature of this Zoom room. I'm going to be presenting the entire time, so some of my colleagues are in today's session with us, and they'll answer those questions as best they can as we go through it. You can always feel free to send an email to covid@kippbc.org with any questions, and we'll get back to you as quickly as we can. But again, I won't stop presenting to answer questions, but feel free to ask along the way. Today, we're going to cover three things. We're going to go over the safety protocols, the COVID safety protocols that we've put in place for this school year. I'm going to get specific with you all about when your students should stay home, i.e. quarantine or stay home from school. And then what you should expect from learning when you're quarantining, okay? When your students quarantine. First, I just want to sort of frame for everybody, like how we got to KIPP-DC's protocols and procedures. It starts with the CDC, the Center for Disease Control and Prevention. They are the federal agency, the national organization that provides guidance to how to reopen schools safely and how to do so with COVID or mitigation protocols in place. It's then expected that local governments are supposed to take this national and federal guidelines and suggestions to create the local guidelines and suggestions and policies. So DC Health and OSSI are our local agencies that have taken the CDC guidance and created DC specific guidance for schools. KIPP-DC has taken that guidance and we have used those to implement our safety protocols for the upcoming year. Again, today's session is going to be about going over those protocols for you all. First and foremost is face mask. I can't underscore this enough. This is a thing that's going to keep us the safest that we can be. In our school, face coverings are mandatory for everyone at all times, regardless of vaccination status or age. There are only really a couple of instances where individuals won't be wearing a face mask at school. One is while they're eating. Two, adults who are in private offices with the door closed can have their face mask off. And three, the younger kids who still take naps, while they're napping, they can take their face mask off. All this face mask guidance is 100% aligned to DC Health's and OSSI's guidance for how schools should operate. I just want to show you guys, this is one of those moments where kiddos are going to have their mask off when they eat. They do have some plexiglass shields. Again, we're going to encourage kids to eat quickly, get their mask back on. But again, this is what mealtime looks like at our schools. Two, let's talk about temperature screening. At all of our schools, we invested in temperature taking equipment that sits on the inside of the school. So one of the things is parents might not notice that we're taking temperatures for kids, but at each of our schools, this is one of the machines that we have at every school entrance where multiple kids can walk through this temperature scanner at the same time. As you can see in the picture, the temperatures for the individuals are tagged on their head as they walk into the building. We will, if someone's temperature is above 100.4, it flags as red on their head. And then we would pull that student out of line and be able to put them in quarantine, in isolation, and call you for the next steps, okay? But again, we're taking all students' temperatures as they walk through this into the school building. Again, because parents can't come into the building, you might not see this, but we are doing this at all of our entrances. One of the biggest investments we put into the building in the last year is improvements to our air purification systems. We spent multiple millions this year to make sure that our airspace is as clean as can be in support of trying to mitigate COVID in our buildings, but also knowing that in the future it still will improve. Keeping germs at bay as best we can. Two of the things that we have in place in our buildings. First one is this portable HEPA air purifiers, and so in our classrooms, you'll see that these machines are installed in our classrooms. We have these machines have the ability to do two things. It filters out air particles with its HEPA filter. It also does a second thing, which is really important as it relates to COVID. All the air that's pulled into the system is passed through this UVC light. The UVC light deactivates and kills germs and bacteria and viruses, including COVID-19, so that it puts out air that is that has, if there was any COVID-19 germs in the air or viruses in the air, it would deactivate it and kill it when it sets it back out. So these are in our rooms in the schools. Additionally, we've also installed these UVC light Troffers. As you see in the picture, it looks like one of the traditional ceiling tiles that you see in classrooms. It is different though. You'll see the vents that are on the side of that light. What those vents do is it pulls air as similar to the purifier that you just saw. It pulls air, puts it through a UVC light, and deactivates bacteria and viruses in the room. Again, with these two mitigation efforts that we have in place, we feel like we've got a really strong way of really purifying the air that our kids and our staff are in. So that being said, there still is a large component to enhanced cleaning that we're doing at our schools this year. First is the standard cleaning that we've had and that we've really tried to really make at a high level happen in our schools, which is a regular cleaning. Those things you see are sweeping, mopping, vacuuming, trash collection, and wiping down of surfaces. In the event that there is a positive case in our school or a positive case in one of our classrooms, the next step is to take a further step with a deeper clean that's called an electrostatic disinfection, okay? This electrostatic disinfection is done via a Clorox 360 machine, as you see. What this machine does is it sprays a disinfecting solution across all the surfaces of the classroom, so that really any viruses that are still left behind would definitely be deactivated and killed at that point. Additionally, we really had we're having a big focus on hand hygiene this year. For any parents who are parents of younger kids, pre-K3, pre-K4, kindergarten, most all of those classrooms have bathrooms inside the classrooms. So those classrooms have sinks and water and the ability for kids to wash their hands in those rooms. In our lower elementary school classrooms that don't have bathrooms, we've also installed these portable sinks, which you see on the left, as a second option for how kids can wash their hands. Additionally, outside of every single classroom and office in our buildings, we also installed these wall mount hand sanitizers. If you've been in the hospital, you know that outside every hospital door, it has those hand sanitizing stations. Similarly, at our schools, outside every single door, we have these. And so we really put a huge focus on making sure that hand hygiene can be as good as we can for our kids. The other really big investment that we're putting into this year is regular COVID testing. At our schools, all staff and students will test regularly for COVID-19. Staff testing has already started. We started that on August 10th, and all of our staff are testing weekly. Student testing is shooting to start. We plan on starting that the week of September 6th, so not this coming week, but the following week. And we plan to test all students. We made a big change to our testing program for this year. Initially, we were planning on doing the same nasal test, the nasal swab that kids did last year via pool testing. This year, we moved to individually test every single student and not do a pool test. Every kid is individually tested via saliva-based testing. We had some parent feedback that there was concerns about the swab method of testing, and we felt that shifting to an individual test would give us even better data. So we switched to this individual saliva-based test. In order to do this, every student needs to fill out testing consent forms, which we have recently sent out and will continue to collect. I think maybe about a little more than half of all of our families have filled out the testing consent form. We're going to push to get everyone to fill this out. So parents, please look at your emails, look for the testing consent form via Panda Docs, and please sign off on that. That'll allow us to get started as soon as September 6th, as soon as we have as many families as possible signed up with the forms. This is a pretty robust approach to testing. Lots of districts, both in DC and other places, are really only testing a small percentage of their kids, 10%, 15% of students. But our goal is to test all the students and staff in the building to really try to make sure we can create the safest environment we can for our kids. This is no small undertaking, and while we think, and we know this is really important. The only thing I'll mention about COVID testing is that these tests will be distributed throughout the week. So depending on your kid's grade, they may get tested on a different day throughout the week, but the testing will happen throughout the week. As I mentioned before, students are going to be tested individually, not pooled, and it'll be via a saliva-based test. Again, this individual test is really nice because it gives us immediate, specific results about individuals that we can really focus our contact tracing efforts on. Parents, if you guys, if your student through our testing program is positive, I promise we will reach out to you immediately and let you know, and you will hear from us. Okay, so just again, if your student's positive, we will definitely reach out and let you know. And again, one of the things that we're really going to support us in our ability to like really contact trace is going to be seating charts. All right, let's talk about quarantine protocols. When to stay home. There are lots of emails that you will get this year that are going to help us stay informed about what's happening in our buildings and what to do. The first one is your daily COVID check. Like that is one that you guys are already receiving. I know you've seen them already. You get this email every day asking you to check and answer these questions about your student and how they're feeling to make sure we know if they should come to school or stay home, right? If for any reason that while you go through this daily COVID check and your baby has symptoms, we're going to give you the exact instructions on what to do, okay? But first things first, if you see the daily COVID check, there are 5 main questions you need to answer. The first one is, number 1, in the last 10 days, have you tested positive for COVID-19? This is really straightforward. If your student has tested positive for COVID-19, they do need to stay home and they need to quarantine for at least 10 days, okay? The second question is, do you have any COVID symptoms such as fever, cough, trouble breathing, headache, loss of taste or smell, or otherwise feeling unwell? If you have any COVID specific symptoms, your student should also stay home, okay? And in this email that we send you, it gives you the specific steps to take if you answered yes to any one of these things. Okay, so for example, on the next slide, you'll see that if you said yes, my student has symptoms, at the bottom of the email tells you exactly what you're supposed to do in the event that your child has symptoms. But again, with all these questions, if you answer yes to any of them, it's going to mean that your student has to stay home for some period of time, okay? But again, the specifics of how long and what you need to do are located in the email. The third question you're asked is, if your student's not fully vaccinated, and let's go and say most of our kids are not fully vaccinated, and if they're not fully vaccinated, in the last 10 days, have they been in close contact to a person who tested positive for COVID-19? Close contact means, have you been within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period? So if your baby, your student, has been in close contact with someone who tested positive, they do need to quarantine for 10 days, okay? It doesn't mean that they should get a test and then come to school. It means that they have to quarantine for 10 days. Again, the instructions on if you say yes to this are in the email, and you should follow those steps, okay? Again, this is the scenario where if your student, if someone in your family, let's say one of the parents start to feel unwell and you find out that one of the adults has COVID, that means your students have been in close contact with the adult and they do need to stay home for 10 days. It might also happen that you guys were over at a cousin's house over the weekend and you find out that one of the cousins tested positive. Similar situation, that you should quarantine for 10 days as you guys have been exposed to COVID, okay? The next question is, if you are not fully vaccinated and you've traveled outside the DMV in the last 10 days, you also have some travel restrictions of which you need to verify uh, via the screener. It'll tell you what steps you need to take in order to make sure you quarantine or test, okay? The fifth item is if you aren't vaccinated and someone in your household, someone in the student's household is awaiting a COVID-19 test, or if that student themselves is awaiting the results of a COVID-19 test, you should not bring the student to school. They do need to stay home, okay? Until those results come back, the student should stay home. What we don't want is that someone is waiting for a test, they've been coming to school, then all of a sudden they get the results of their test and we're like, oh no, the other students in school have been exposed to someone who's had a test. Again, the city recommends that we ask these 5 questions. And if you say yes to any of these questions, you should quarantine and follow the steps that we have in the email. Again, this last one's really important, that if anyone in the household is waiting for a COVID test, everyone should stay home until you get the results of those tests. Again, this is the email that you receive. In that email, you should be able to know all the next steps that you do need to take in the event that you answer yes to any of those questions. All right, you might also get an email to alert you that that you have had potential exposure and that your child should stay home. I want to explain one concept about potential exposure that really matters. There is this concept of the 48-hour rule that individuals are in their contagious window in the 48 hours leading up to either a positive test or their first symptom. So let's start with an asymptomatic student, a student who has no symptoms at all, but they took a COVID test to be safe, precautious for whatever reason, or maybe it's through our testing program, and they had no symptoms, and they tested positive. The way we would calculate is who was in their any close contacts that were in their infectious window, which is the 48 hours leading up to that test, are folks who have to quarantine. So let's say that every Friday evening, I take a test with my family just to make sure we're safe. And at 5 o'clock on Fridays, I take my test. I find out my results and I feel fine. I find out my results on Sunday, and I happen to be positive. That means that 48 hours before my test, everyone who was in close contact with me does need to quarantine. So that, again, if I took my test at Friday at 5 p.m., it's everyone from Wednesday at 5 p.m. all the way up through Friday at 5 p.m. who have been who have been close contact with me. Those folks do need to quarantine, okay? The other example is 48 hours from your first symptom. So let's say we have a student who is at school, partway through the day, they start getting a cough and they start feeling well. We send them, we pull them out of the room at 2 o'clock on Wednesday, and we send them home. The parent takes the student that evening, or let's say Thursday morning, to go get tested because that's the first time they could get the test. And they get it back, the results on Friday and Saturday, it says that it's positive. We start the 48-hour clock from the first moment the student had symptoms. So in this scenario, the student had symptoms at 2 o'clock on a Wednesday. So we look back to Monday at 2 o'clock. So basically, whoever was in school with that student on Monday and Tuesday and Wednesday to figure out who are the close contacts for that student. Again, that is the way the CDC and DC Health sort of tell us how to figure out who is within the exposure window of students. So let's talk about if we determine that a student was exposed to COVID outside of school, i.e. you guys tell us, you call us or you send us an email, hi, my student won't be coming to school. They've been exposed to COVID. It could be a parent, it could be a friend, it could be a cousin, whatever it was. They were exposed to COVID outside of school. Someone from our KIPP DC contact tracing team will reach out to you, okay? The first thing we're gonna find out is we're gonna try to find out all the details of the exposure, okay? The potential exposure that your kid has gone through. The first thing we'll ask you is your student vaccinated or not, okay? For non-vaccinated students, if your student is not vaccinated, they've been potentially exposed, You do have to make sure your student quarantines for 10 days. You should get a test, a COVID test, and make sure they stay home and monitor for any symptoms. Okay, if they are not vaccinated, they do have to quarantine. If your student is vaccinated, and this really applies for some of our older kids, they won't need to quarantine for 10 days, but they should get a test. Again, they should get a test. The one thing we'll say that if a student's waiting for a test, again, we generally say that students who are waiting for tests should avoid coming to school, and they should wait for the results of their test to come, okay? But again, you shouldn't need to quarantine for 10 days if you're vaccinated. I want to tell you guys a little bit about the positive cases we've seen so far. And I have no doubt that parents, you guys have seen the emails come into your inboxes, and maybe sometimes multiple days in a row. And it can feel a little alarming and a little anxiety producing and inducing. I want to share with you guys what we have seen really to date has been the case for any cases that we can see that are connected towards each other. What we've seen happen in multiple cases is that a family member, a parent will reach out to us and say, one of my students tested positive for COVID. In that group of 4, one of those students tested positive. Then when we ask them, are there any close contacts? They'll name some siblings or some cousins or someone that they ride to school with, and they'll identify that there are a handful of close contacts. We'll then tell those close contacts, you need to stay home and you need to get COVID tests. And then over the next couple of days, we'll get the results of those COVID tests. And so while you'll see that we might send an email day after day, oftentimes these cases are related outside of our school community. And so you'll have the pre-K3 sibling who originally tested positive, and then subsequent siblings or family members or folks who have been in close contact with them end up testing positive over the next couple of days. And that's how we've seen the most number of our cases that are connected, how we've seen them play out. And again, that's how we've often seen multiple emails come to you guys over the last couple of days. So let's say let's talk about potential times that your student might need to quarantine due to a potential exposure at school. That would happen in a situation where we found out that a student who was in school tested positive for COVID, i.e., this scenario often looks like, again, we had a student in school, they started to develop symptoms during the school day, we sent them home that day, they got tested the following day and it comes back positive. Then we have students who are in school with a positive individual. The first thing we do is that we contact that student's family and we ask them a set of questions. And really that's about determining that 48-hour rule. We ask them, when did the student first have symptoms, if they had any? We'll ask them, when did the student take their COVID test? When did they receive the results? And when were they last in the school building? From there, we'll have determined what the 48-hour rule and which classrooms or adults apply to in-school potential exposure. We'll also ask that family member if there are any additional adult close contacts, specifically KIPP staff, who are in contact with that family, i.e., I might be a student at a KIPP school, but my aunt is also a teacher at the schools. And so she drives me to school every day, or I see her on the weekends or whatever it may be, or I wait in her room to come home at the end of the day. Any of those things may be true. And so we will ask them if there are any adult close contacts. Second, we'll also check to see if there's any other student close contacts. Are there any siblings in the household that go to KIPP? Are there any cousins or family or friends that they ride to school with, to determine if there are any other students that do need to quarantine? Again, as soon as we get that info, then we will determine who needs to quarantine. One of the ways that we determine who needs a quarantine varies by grade a little bit. In high school, any of the students who are in close contact of the positive person must quarantine for 10 days. And then we'll send the email out to those families to make sure they know. In pre-K through 8th grade, our current policy for who needs to quarantine due to potential exposure is the entire classroom of students. Again, from pre-K through 8th grade, the entire class of students will quarantine for 10 days if they're unvaccinated. In the future, what we're hoping to be able to do is to quarantine just the individuals who are close contact of that pre-K3 through 8th grader, and just have those couple of individuals quarantined for 10 days. Um, I want to, this is how the city's guidance is shifting, but I want to be candid about like how we can do this. It is very difficult to think about how we're going to identify a pre-K 3 student and who their immediate close contacts are, to figure out who are the people who within 6 feet for 15 minutes of that pre-K 3 student. That's going to be a lot harder to do than it is for high school students. Again, high school students were able to do that now, but with the pre-K 3 kids, I don't know how we're going to do that yet. So we're still trying to figure out how we can do that safely. I could see the scenario that in 8th grade, we might be able to ask 8th graders to identify who those close contacts are, and we'd have a better shot at doing that. Again, this still remains to be seen how we're going to implement this part of it, but we hope to be able to do so, but do so safely and age appropriately. All right, so what happens if it's deemed that your child was potentially exposed to COVID at school? Here's the things that you're gonna see, and this is how we're gonna move through them. The first thing is you're gonna receive an email from the COVID team. It's gonna be specific to your child and their specific situation. We're gonna tell you that they've potentially been exposed, and we're gonna give you the next steps of what you need to do. Additionally, we're gonna send you a text message and say, hi mom, hi dad, hi grandma, please check your email. We sent you an email regarding your quarantine situation. Please let us know if you have any questions. In the email, it'll also tell you when the quarantine starts and ends and what day your student can return to school, okay? We'll also give you some guidance on what remote learning will look like for your student in the event that they're again, assuming that they're gonna be virtual for they're going to be in remote learning for 10 days of quarantine. We'll tell you sort of what learning will look like. We'll also make sure that we tell you very strongly that you should get your student tested in order to make sure that that they don't have COVID, and you try to minimize any spread in your own household. Okay. I just want to underscore these two items that are at the bottom. Like, we are here to try to support our families as we navigate COVID and quarantines. And really, quarantines are really about everyone's safety together. And so while quarantines are not fun and really put a burden on families, it is really about our collective safety. One thing I want to note for you guys about, we get a lot of questions about siblings. Okay, so my pre-K, my 5th grade student had potential exposure in their classroom. What about my his pre-K 3 sibling? The way it says is that only our guidance given to us is that only the students who are in that exposed classroom and who have potentially had that exposure have to quarantine for 10 days. So only that 5th grade student should quarantine. The siblings of the students in that classroom do not need to quarantine. But here's a sort of catch to that. But when you take your student, if you take them to go get a test, if you take that 5th grader to go get a test, that the rest of the household should wait for those results before returning to school. So this goes back to the screener question that I showed you guys, that the 5 questions that you need to ask yourself every day, that if someone in your household is awaiting the results of a COVID test, you should quarantine, you should stay home. Again, so this is that scenario that my sibling is waiting for a test. I should stay home until I know my sibling is positive or negative, okay? Again, guys, we're here to support you all, and really these quarantines are really about student safety, and we're really trying to hold very tight to this in order to make sure we keep our buildings as safe as we can. Next, I just want to talk about what learning will look like as your student will be quarantining. Again, right now, as we do have some pods that are closed, the learning looks like a combination of packets and Zoom instruction right now. In the future, we hope that if and when we do need to have any pods go into quarantine, that the instruction will be primarily Zoom instruction. For us to be ready for Zoom instruction, there are a couple things that need to happen and the most important thing is to make sure all kids at home have their Chromebooks ready to go. So the first thing we're asking for all of our returning families, that you check your Chromebooks that you have at home, make sure that it turns on, make sure the power cord works, make sure everything is working fine with it, so that we can, in the event that you do need to have any Zoom instruction, you're ready to go. And if for some reason your device doesn't work, on our website on the family resource page, there is a form you can fill out to request support in getting your Chromebook fixed. So please go take a look at that if indeed your Chromebook is not working. If you are a new family to KIPP DC, please be on the lookout. We should be sending emails out shortly to tell you more about how you guys can pick up new student Chromebooks. And so we're working on that right now. So just again, please keep an eye out for that email. You also get, some updates on emails around regular health updates for our school. Again, the first one that you should be getting is that daily COVID check. Um, you might also get emails that tell you a little bit about what's happening in our building if we have any positive cases. We do want to keep our entire school community, keep everyone informed about what's happening in the building. That's likely the emails that you all have seen to date, where we have told you that there's been a positive case in your building and telling you what we're doing to continue to support our schools. Again, this is one of those things where I think sending this email we feel strongly it's the right thing to do, that it keeps all of our community aware of what's happening, but it can also increase anxiety as you see these positive cases pop up in your child's school building. Again, as I shared with you guys earlier, it seems uh, pretty obvious to us that a lot of the spread that we're seeing is really from contacts outside of school. And that's how they're really connected within our building. So again, we want to make sure that we keep you all families alerted about what's happening in our buildings. Again, those are our KIPP DC health and safety protocols. There are a couple things I'm going to ask, and we're going to ask all of ourselves and our families to do as we continue to navigate the school year. The first is just please, please, please monitor your student for symptoms. Like as minor as symptoms can be, particularly for our younger kids, we got to make sure that students who do have symptoms stay home and get a COVID test. That is going to be our best way to make sure we don't have spread happen in our buildings, is to make sure that if your baby is not feeling well, keep them home, get them a test. As much as you can, social distance from other kids and other families as best you can, so that we can avoid any spread. And again, avoid travel as much as you can. And if you're doing any of these things, make sure that you wear your face mask. That is the biggest protection we have as we navigate and move out through our communities. Last but not least, the COVID-19 vaccine is available to all students and adults ages 12 and up. In the city, there are many places to get access to vaccines, and there are many incentive programs that the city is running for young kids, for our young teens to get vaccinated. So please take a look at that if you're interested in getting vaccinated. There's also a federal website, vaccines.gov, that gives you more information too. So please, if you think vaccination is right for your family, please go do that and go take a look. All right, that is our presentation on our safety protocols that we have in place. I hope I answered a lot of the questions that our families have had. I want you to feel free to continue to add questions into the Q&A. We're going to leave that open for another 2-3 minutes if there's any additional questions. Please also know that you can send any email questions to covid@kippdc.org, and we'll make sure we get back to you. We plan on this video is being recorded, so we are going to send this out to all of our families that weren't able to make it, along with the FAQs, the frequently asked questions that we saw from parents over these last 2 sessions, to make sure that we try to give parents as much information as possible. Again, I thank you guys for spending an evening coming to hear more about our COVID protocols and asking questions. I'll leave the chat in this room open for another minute or two as I want to see if there's any additional questions that come in. And if not, if you don't have any questions, please have a wonderful weekend, wonderful evening and weekend, and be safe. Thank you. Okay, if there's no more questions, please have a wonderful rest of your evening. And again, please be safe.